Have you ever wondered what exactly happens during a breast implant surgery? Well, you're not alone in your curiosity. Each year, countless individuals explore the world of cosmetic surgery, and breast augmentation is one of the most popular procedures. From enhancing self-confidence to reconstructing after mastectomies, there's a myriad of reasons why people opt for this transformative step. But what actually happens behind the operating room doors? In the next few minutes, we'll unravel the mystery behind this common cosmetic procedure. So, how does a breast implant surgery kick off? Well, it all begins with a heart-to-heart consultation. Here, your surgeon will discuss your goals and expectations, ensuring they align with what's feasible and safe. It's a collaborative process where you are not just a patient, but an active participant in the decision-making process. Next comes the critical task of choosing the right implant type and size that will best suit your body proportions and desired outcome. Whether it's silicone or saline, round or teardrop, the choice is yours, with guidance from your knowledgeable surgeon, of course. The incision location too is a point of discussion, as it can significantly impact the final appearance of the implant. Now, with all these decisions made, it's time to gear up for the big day. This might involve some medical tests and physical assessments to ensure you're in the best health for the procedure. With the specifics determined and preparations complete, it's time for the actual surgery. Now let's delve into the heart of the matter, the surgical process. The first step in the surgical process is the administration of anesthesia. This is done to ensure that the patient is comfortable and free from pain throughout the procedure. Typically, general anesthesia is used, but in some cases, a local anesthetic may be combined with sedation. Once the patient is comfortably sedated, the next step is to make an incision. The location of this incision varies depending on the specific procedure, but it's typically made in inconspicuous areas to minimize visible scarring. Some common incision sites include under the breast, around the areola, or in the armpit. The surgeon's skill and the patient's body type play a big part in determining the best location for this incision. Following the incision, a pocket is created to house the implant. This pocket can be made either under the pectoral muscle, which is known as a submuscular placement, or directly behind the breast tissue, known as a subglandular placement. The choice between these two options depends on the size of the implant, the amount of breast tissue the patient has, and the patient's personal preference. Now comes the moment we've been building up to, placing the implant. The implant, which has been pre-selected according to the patient's desired size and shape, is inserted into the pocket that has been created. The surgeon then adjusts the implant to ensure it's sitting in the perfect position. Finally, once the surgeon is satisfied with the placement of the implant, it's time to close the incisions. This is done with sutures, skin adhesives, or surgical tape. The surgeon's primary goal here is to minimize scarring and ensure that the incisions heal smoothly and neatly. And there you have it. From anesthesia to incision, pocket creation to implant placement, and finally closing the incisions. That's the surgical process in a nutshell. It's a delicate balance of science and art, all aimed at enhancing the patient's natural beauty. With the incisions closed, the surgical part of the procedure is complete. So what happens after the surgery? Post-operative care is a crucial component of any surgical procedure, and breast implant surgery is no exception. It's a period that requires careful attention and adherence to your surgeon's instructions to ensure a smooth and successful recovery. Immediately after the procedure, you'll likely experience some discomfort, which is completely normal. Managing this pain effectively is important, and your surgeon will prescribe appropriate pain relief medication to help you through this initial period. Now, let's talk about bandages. These are not just for show. They play an important role in protecting the surgical site and facilitating healing. You'll need to keep the bandages clean and dry, and your surgeon will guide you on how to do so. As part of your post-operative care, you will also have follow-up appointments with your surgeon. These are not to be taken lightly. These appointments allow your surgeon to monitor your recovery, address any concerns, and ensure that the implants are settling in as they should. Remember, it's all about following the surgeon's instructions. This isn't a time to improvise or take shortcuts. Sticking to the plan laid out by your healthcare professional is the best way to ensure a successful recovery and achieve the results you desire. In essence, a breast implant surgery involves a thorough consultation, careful preparation, a meticulous surgical process, and dedicated post-op care. It's a journey, but for many, one that leads to enhanced self-confidence and satisfaction.